Thank you so much for coming. I'm really happy to see you all here. And we're going to be talking about Communities for Healthy Food, which is a program that LISC New York City has been running since 2014. I am the Senior Community Development Officer for Green and Healthy Neighborhoods. And we're going to have our panel. So guys, come on up. So on our panel, we have two community organizations whose staff have been with this initiative from the very beginning. From New Settlement Apartments, we have Tazy Kong, who's the Director of Community Food Action and started this work up in 2014. And we also have Julie Alcantara, who's a Food Corps member who provides Communities for Healthy Food services directly in the schools where New Settlement Apartment partners. And then from NEPCO, we have Bianca Bachman, the Food Justice Programs Director, who also built this program from its beginnings at NEPCO. And then we also have Nick Freudenberg, the Director of CUNY's Urban Food Policy Institute and our research partner with Communities for Healthy Food. So LISC New York City started Communities for Healthy Food in 2014. We saw that many of our CDC partners, like this is better? Okay. A little shaky. But we saw that many of our CDC partners were interested in doing work around healthy food, and to that point had only mostly been able to do sort of isolated projects, and we wanted to support them to take a more holistic and strategic approach. So with generous support from the Illumination Fund, we were able to tackle that work. We provided funding to the organizations as well as peer learning, training, and technical assistance, and connections with citywide partners to help implement this work. And CUNY was with the program from the beginning as an evaluation partner to help the groups develop a theory of change and an overall evaluation approach. So there were 4 original partners, each of which is a multi-service community-based organization: New Settlement Apartments, NEBCO, Cypress Hills Local Development Corporation, and West Harlem Group Assistance. And then we added a 5th organization, which is Banana Kelly Community Improvement Association. So you can see on the map where each of those organizations is based. Okay. And then each organization went through a similar process. We helped them to conduct really thorough needs assessments to identify both the needs and the assets in their communities as it relates to healthy food. And then out of that assessment, each group created a set of strategies that was tailored to their neighborhood. So these varied but included farmers markets, CSAs, SNAP enrollment, nutrition education, client choice food pantries, community gardens, and youth leadership development, and other strategies as well. And so then after they had that set of strategies, they implemented. And one of the really exciting things about the program was that it allowed for experimentation and iteration, so that they were sort of had that luxury to try things out, scrap things that didn't work so well, and go deeper with things that really took root in the community. So we're going to get into more detail later, but we're really proud of the accomplishments and the results on the ground. So you can see a few of these data points here. There's more than 46,000 residents who've been engaged in the programming in one way or another. We have 58 new or improved places to access healthy food, and other results that we'll get into a little later. And we are also really proud of the Communities for Healthy Food Toolkit. We've got some copies out there. And it's really sort of a distillation of everything that we've learned over the years about doing this work. And it gives lots of detail about the really practical elements of building this programming and some of our lessons learned along the way. So our panel today is going to give some insight into some of what's discussed there. We're going to start, yes, with Tazy. And one of the key components of Communities for Healthy Food has really been partnerships. So I wanted to know if you could talk a little bit about like a specific example at New Settlement Apartments about why you chose to partner with schools in particular. What were the opportunities that you saw there, and what were some of the challenges?
Morning, everybody. So Emily mentioned our needs assessment process that we started off with during planning. And that was when we really took a look at what New Settlement's strengths were, and we do a lot of work with children and families. New Settlement also has a long history of working with schools in the neighborhood through our many after-school programs. We also do education justice organizing, and we also had recently opened the New Settlement Community Campus, which houses public schools. So schools were really a good fit in that way. We also serve the District 9 within DOE, and District 9 is unfortunately one of the lowest performing school districts in the city in terms of academics and test scores and many other kind of aspects. So for us, it was really important to us to focus on fighting for the rights of our children in terms of food as well as other issue areas. We also found that schools really do get that at least basic concept of why food and wellness matters. That term that we hear a lot about how kids who are hungry can't learn. I think that's like a baseline that most schools really understand and something that really resonated with the principals that we've worked with. And then it's kind of evolved from there to like a deeper understanding. So I'm going to share a little bit about PS 294, which is an elementary school that we work especially closely with. It's an elementary school right in our neighborhood. We're in the Southwest Bronx in kind of the Mount Eden neighborhood. And we've really found that this school has shared values with us, which has been really important. Among other things, they're a community school, which is a DOE designation. And it's basically a neighborhood hub. And their kind of three pillars of community schools are high quality academics, social services, as well as community engagement. And we found that that was a really good fit for our program with Communities for Healthy Food, since we also take a comprehensive approach and we're all about community engagement. We also found that it was really a good fit for PS 294 as well, and that they've really appreciated our partnership, and it's become really a mutual collaboration. So in part, one of the things we've been able to do for the principal of PS 294, Mr. Russo, he's really interested in making sure that academics are really high quality. That's been a really strong focus, and we've been able to incorporate our cooking and gardening lessons into the academic standards and make sure that they're aligned so that when our students are doing these lessons, it's not like an extracurricular or something like that, but rather embedded into the school day and what the kids are already learning, and a really nice way to reinforce those concepts. He's also shared with us that so PS 294 actually opened the same year that Communities for Healthy Food started. It was a new school in the neighborhood. And Mr. Russo, it was his first time as principal. And he since shared that when he started, he was a little bit concerned about making sure that he understood the community that he was serving and could connect to the parents. And his relationship with New Settlement programs, including Community Food Action, has really allowed him to get to know the community better, make connections with parents, and build a really strong relationship there that I think you can really see when you're at the school. So we've been able to be a part of that. And then one example I'll give about how we've been able to connect our work in schools to our comprehensive approach. Last year we opened the 170 Farm Stand, which is a youth-run farmers market. And we were able to locate it just down the street from the school, actually like right outside of the playground gates where the school dismisses from. So every single market day, students are exiting at dismissal and from after school program and coming right by our farm stand. And these are students who are participating in classes with us during the day, who are also getting good food at lunchtime thanks to our partnership with Wellness in the Schools. And they're really primed to want to kind of be interested in the fruits and vegetables that we're selling and be really open to trying new things. We have a farmers market for kids program, so the kids get to also try things. They go through a little workshop and learn about the fruits and vegetables and get to try them in new recipes. And we really found that these students have been much more kind of like ready to embrace new things. And then they actually get to, at an accessible price point, bring some fruits and vegetables home to actually cook at home. So hopefully the idea is like extending what we're doing beyond the school day. So a little bit about lessons learned. I'll say one challenge is that we do realize that our schools are, food and wellness is not their number one priority, obviously, right? So we try to accommodate that and be understanding that they have other higher priorities, but also that doesn't mean that they can't do this work as well. We've also learned the importance of having a well-functioning school partnership, that being that the schools are actually well-functioning. And this is a challenge, but things like communication and follow-through are super important, not only for during the school day, but also in terms of our partnership with them. And with that, I think the next question is for Julie. So I'll just say one of the ways in which we've worked really closely with PS294 is that we're a service site with Food Corps. And this year we have a Food Corps member, Julie, who's actually a parent from the community. So she's going to get to share much more about her work at 294.
Okay, thanks. So Julie, I wanted to ask if you could just share sort of one thing that you're really proud of that you've been able to accomplish in the schools, and then one thing that has been more of a challenge for you.
Hi, good morning, everyone. Well, working in the school and which in the community that I live is being, amazing for me, because when I first started going to the school, two of my three kids go to this school, I just started volunteering in the school. And then I found out that I was able to do something else for the community and for the school. So one of the things that as a Food Corps members that we have lots of challenges and something that always we are proud of. But most of all that, one of the things that I'm really proud of is, for example, when I get in the classroom, and especially when I bring a cooking lesson for the student and I see all those faces excited about cooking and trying something new. But then when I always start by doing a brainstorming to know how much they know about the ingredients that we're using on that day. So when we get started in preparing the recipe and I hear somewhere on the back, I'm not gonna try that. I have never tasted that before. I just target that student. And when it's time to taste, I just got closer to the student and I encourage him or her to taste together. And when they do, so you see, it's not that awful. It's not that bad. I just taste it. And then she or he ends up asking me for a recipe card to try at home with their family. But the most important part is that when they see me the next time and they let me know how well it went and how much they enjoy it, this is something that really made me, oh man, I made it. Oh yeah. And this is the main goal, to have kids to be open-minded and try new things every single day. But also the challenges, I think that we have more challenges than other things. Because at first we have to, when the school begins, we have to start building relationship with the teachers, with all the school staff, which is not that easy because everybody is focused on their things. So we have to make sure that they know me and they know, So this is the thing that we have to do at the beginning of the school year. But the most important part of the challenging part is when I have to schedule a lesson, which a lesson has 15 minutes each period, and the teacher gives me, for example, the last period, which starts at 1:30. 1:30, 15 minutes, is supposed to end at 2:20. And then when the kids are not ready at that time for learning, because sometimes they're coming from gym or coming from the lunchroom or coming from the playground. So they are so excited. They're not ready to learn. They're still focused on other things. So that's my challenge part, to get them focused. Like, hello, now we're ready to learn. So the challenge is when for example, the recipe that I taught in another classroom and I bring it to this class, that is the last period. So I have to be to have like a magic. magic wand. Let me turn this into really fast. And the job that they are supposed to do, for example, to do some math or some addition, adding the ingredients on the recipe, I have to do it by myself because then we don't have time to taste the recipe. And then, this is something that I feel kind of bad at the end of the lesson and just have to skip all those things and do it by myself. This is the part that I feel kind of bad about this job. But the lesson learned of all of this is just to have teachers to understand that our lessons, our cooking lesson or healthy lesson as I call them, are as important as any other subject. And I think that we have to get the teacher to be in the buy-in and, to make them understand how important it is to teach nutrition in the classroom so we have the kids on our kids to be healthier for the future.
Thank you. So Bianca, one of the things I wanted to hear about from you was that as I mentioned, the Communities for Healthy Food program has really allowed for a lot of experimentation and growth over time. So I wanted to know if you could speak a little bit about NEBCO's Community Chef program and how that's evolved over time.
And this is already on? Yeah. So impressed. Let's see. Our Community Chef program, kind of like all of our programs, was born out of a 3 to 6 month needs assessment process that we did right in the beginning of this project. And as part of that needs assessment project, we went out and saw other examples of how people were doing culinary and nutrition education in the city. And because we were thinking, okay, this is something that this community might need or want. And what we saw a lot of was a lot of examples of people bringing in people from outside the community, not paying them, using volunteers to teach people from the community how to cook. And at the same time, during the same needs assessment process, we were seeing, we're based in Bed-Stuy in Brooklyn, and we were seeing that there are so many people in our neighborhood with good food knowledge. So many of the sort of like older population in the neighborhood are coming from the South, they're coming from the Caribbean, and these are people that grew up with backyard gardens on small farms. They grew up learning how to cook where food culture was so important to them, and now they're here in Bed-Stuy. And what we found is that the issue isn't that nobody in the neighborhood knows how to cook. The issue is that so many in the neighborhood do, but for some reason that information wasn't getting passed on. So what we were interested in looking at was, could we train all of these people to share their cooking skills with their neighbors and have our culinary and nutrition education be founded in knowledge sharing and community sharing with community. And another piece that was important that Emily alluded to was partnerships. And from very early on, sort of with each of our programs, where we saw that we weren't the experts on things, which quite frankly, we weren't the experts on most things at the beginning, we wanted to bring in partners. So we wanted to train these people to be community chefs, but we didn't know how to do that. So we partnered with Just Food, and they did their community chef training program for 20 people who had enrolled in the program for us. And out of those 20, we got 8 chefs that stuck with us. And in the early years of programming, we had about 30 cooking demos a year, a couple of culinary courses a year. And then we got so much more funding through the USDA Community Food Projects grant. We also got increased funding for short-term funding to do a bunch of cooking demonstrations. So we were looking at going from like 30 cooking demos in a year to like 180. And so we were like, whoa, we need a lot more community chefs. And so in 2016, we were excited to bring on more community chefs. But at this point, we had learned quite a bit. We did a lot of testing, we did a lot of programming, and we learned a bit more that our community chefs needed more education around food systems, that they needed more around seasonality and other things. And some of that stuff Just Food offered, and some of it they didn't. And we thought, well, at this point, I think we can do this community chef training ourselves. So we went through a whole 4-month process of designing a curriculum for it, and then we ran our own community chef training in 2016, brought on a whole new batch of community chefs. We now have about 23 who are working regularly with us. And then now we're going through a whole, it's been almost a year now, long process of developing our own curricula. So for our culinary courses, we've historically been partnering with Family Cook Productions and using their curricula to teach our courses for families and our courses for adults. But we're now in the process of designing that as well, again, with tons of community feedback, with tons of feedback from our community chefs about what it's been like to implement that curricula, so that we have one that is really catered to our community, and to our belief that changing diets isn't where this work even starts or ends, that it's really about a system that created the community and the community health that we're facing. And so our culinary curricula is very much focused on food systems and food justice as much as it is the culinary stuff. And we teach that alongside. While we have our hands in the food, we're talking about systems. So we're really excited to premiere that culinary curricula this summer. And then finally, the next evolution of our community chef program is that all of our community chefs are currently consultants with us. They work as independent contractors with us. And we now have our eyes on turning our community chefs from independent contractors with us to a worker-owned cooperative. So whole other piece of our work is that we've been doing worker-owned cooperative development work for the last number of years. And now we're looking at, well, what would happen if our community chefs became a worker co-op? And what would happen is that they would be able to take on a lot more work, because right now, their ability to take on gigs, basically, is only held back by NEBCO's capacity to accept the gigs, right? And so they could actually serve a lot more communities and a lot more people if they were on their own. And then ultimately, it's also more about community leadership. That becomes more and more and more important to us. We'd like to see that grow, and while we seeded the project, while we started the project, we really want to see the community take ownership of it. And for these community chefs to have ownership of their own work would be amazing. So we're really excited to get that going as well. So I'm sure there'll be many more evolutions of this program and project, but that's where we're at now.
Hand it over to Nick to discuss the evaluation. Do you want the clicker or you want to stand up there? Okay, I'll grab it.
If you can just advance, I guess, give me
Sure.
the clicker so I can. Good morning, everybody. It's nice to be able to hear and talk to each other. In the first year of Communities for Healthy Food, LISC hired the CUNY Urban Food Policy Institute to evaluate the implementation and impact of the program. And through a collaborative consultation with LISC and the CDC managers and frontline staff, we designed an evaluation that was multi-method and multi-level. And our assessment included surveys of 600 households, 150 in each of the 4 neighborhoods, in years in 2014 and again at the end of 2017. We did multiple focus groups in each of the sites. We did community food assessments. We interviewed CDC staff and also partner staff. And then we reviewed all the documents produced by the reports and by LISC. And our evaluation made 3 different kinds of comparisons. We compared the communities and the residents in 2014 to 2017. We compared each community to itself in the beginning and at the end, and to the other communities. And we also asked in our surveys individuals to tell us how much they had participated in the events that the CDCs were sponsoring. And I think, just for my public health colleagues, in this crowd, CDC means Community Development Corporations, not Centers for Disease Control, so we're all on the same page. And So we asked people how much they'd participated in food activities, and we compared people who had participated not at all, a little, with those who had participated a lot. So that was the evaluation question. And our evaluation was based on the theory that the changes that Communities for Healthy Food encouraged in individuals, organizations such as CDCs and their partners, and in local food environments would ultimately lead to improvements in both health, nutritional health, and community well-being, as well as community development and community economic development. And reducing the stark inequalities in health and food access between the communities that CDCs served and other better off communities was a key goal of the program, and we wanted to understand how that played out. And I think you've already heard some of the ways that it did. As public health researchers, our ultimate goal was to contribute to an understanding of how programs like Communities for Healthy Food could change communities, not just individuals. And I think that was a more challenging assignment because it was, you can see changes in the people who participate, but I think the hope of the program was really to bring about improvements in the community as a whole. So let me summarize some of what we found at each level. At the individual level, comparing the respondents to our household survey in 2014 and 2017, the prevalence of several healthier behaviors increased. And that's good news, and I think it testifies to the ability of a program like Communities for Healthy Food to reach a significant portion of community residents. And through our surveys, we estimated that somewhere between a quarter and a third of the people who lived in the neighborhoods that CDC served had some contact with the program. And in their catchment areas defined by the 4 CDCs, about 300,000 people were residents. So that's a big reach. More work needs to be done to actually document the extent of that change, but I think the findings from our evaluation was programs like Communities for Healthy Food can reach a significant number of people. We saw increases in healthy eating behaviors, in people comparison shopping, in using food labels, in believing that the meals they chose reflected the USDA Healthy Diet Guidelines. And that increased both between 2014 and 2017, and people who participated more reported higher levels. We're not able to tell whether people who participated more were already motivated to change, but certainly the people who were participated in multiple activities made changes in their behavior, and more than those who participated less. An interesting finding was that we found that fruit consumption increased over the period, and again, more for people who participated more, but not vegetable consumption. And I think given the importance that public health researchers attach to increasing vegetable consumption as a prevention of diet-related diseases, we need to explore why one was easier than the other and what it would take to increase vegetable consumption. And we're still a long way in New York City as a whole, and especially in low-income communities, from the recommendations that nutritionists make. At the Community Development Corporation, compared to 2014, by 2017, CDCs had integrated healthy food into many CDC activities. And I think, in hearing what happened in both these places, in both NEBCO and New Settlement, workforce development and healthy food were integrated. In New Settlement, there's been a lot of concern about gentrification and housing affordability. I think the program became a place to look at the intersection of housing affordability and food affordability. For the CDCs, involving themselves in food offered a new way to reach people, deeper the people who they were already reaching, and an additional set of people who maybe weren't connecting to the other issues they were working on. And as we've all learned, food is a very intimate issue connected to daily lives and culture and family. And so it was a good vehicle for the CDCs to engage people in multiple arenas. The CDCs became better known in their communities, both overall and as a place for people who were concerned about food to volunteer efforts. And I think the community chefs is a good example of that, that the CDCs were really able to leverage and tap and develop existing community assets, just those people who already knew how to cook but needed a little push and help to develop that. And they really became a forum, the CDCs, for neighborhood discussions of food justice, affordability, and how to create healthier food environments. There were also some challenges in the partnerships, and I think, again, you heard a little bit about them. Having a partnership work requires a lot of effort, staff time, and that time is lost to doing other things. And I think especially the partnerships that came from frontline staff and managers having a shared vision of where they wanted to go, those were more successful. And those that were imposed from the outside in some way were less likely to be successful. And certainly having shared alignment on goals made partnerships more effective. We next looked at changes in community food environments. And we looked for changes in the local food environment. Now, to the disappointment of our previous visitors, we did not see chicken body parts in the street in any of the 4 communities we looked at. Maybe we weren't looking in the right places. But we did come up with what I think might be some useful insights. The Communities for Healthy Food look to bring about changes in retail food environments, bodegas, supermarkets, and in what we've come to call the community-constructed food environment through farmers markets, food boxes, community chefs, food pantries, all types of activities that several of the CDCs involved in. And I think our assessment from interviews and from our surveys of community residents is that there was more success in creating an alternative food environment that the CDCs and their partners had direct control over, and less success in changing the practices of the bodegas and the food environment. And that led us to hypothesize that local food environment is too generic a term, that there are at least 2 components to local food environments: the community-constructed food environment and the established one. And our belief, because we heard a lot in focus groups and our survey, that both at the beginning and at the end, community residents were pretty dissatisfied with the retail food environment. And their dissatisfactions were on price, like it was too expensive, quality, we don't get the food we want, and service. That's a slightly different story than the food desert story. It's not that there weren't stores there. The stores that were there, they weren't so happy with. And we believe that thinking about food policy that focuses on empowering organizations like CDCs, settlement houses, other community organizations, to develop that alternative community-constructed food environment will perhaps move things forward in addition to the fresh, green carts, healthy shopping, healthy bodegas, et cetera. So that's something to think about. We also looked at changes in partners and partnerships. The CDC's partnerships with other organizations contributed tangible goods that many of the organizations got help from the health department, from City Harvest, from other organizations. And those partnerships benefited both sides. For the citywide organizations and the food security organizations, they had access to the residents of neighborhoods that were difficult for them as an organization sometimes not rooted in that community to reach. And those organizations provided the CDCs with expertise in food and knowledge of food insecurity and help in moving that forward. And I think I've said something about some of the challenges of partnerships. So I'd like to end by talking about some of the lessons on evaluating community food programs. I think, first of all, we came in close to the beginning, and involving evaluators as early as possible helps to make sure that the evaluation reflects the aspirations and goals and capacities of the participants, both the funders, the designers, the sort of intermediary organizations like LISC, but especially the frontline organizations. And designing an evaluation provides a platform for all the participants in an initiative to articulate their goals and to resolve differences and discrepancies. For example, in our first meeting with the CDC staff, they said, we really want to see if this program engages community residents in food justice and food governance. And so we were able to ask questions and develop parts of our evaluation that looked at that question. And the answer is yes, it did, and that's great. That's really important news. We think articulating the theory of change and the resulting logic models can help to design effective interventions. And we think there's many opportunities for the many groups in this room who are doing community food work to work together more effectively to develop evaluations that actually build a body of practice so that we aren't each constrained to reinventing the wheel, to designing instruments, to setting goals. And if we can work together more effectively, we think that will move things along. And we're pleased that Illumination Fund has provided some support to our institute to continue over the next couple of years to provide evaluation support both to Communities for Healthy Food, CDCs, but also to other organizations doing food work so that we can begin to create that collaborative where we better share evaluation expertise. 3 final research questions that I hope to put on the agenda both for thinking about today, but also as we evaluate future programs. 1, how does gentrification influence food environments? In every community where we're working, we see people are really focused on gentrification. And gentrification is not only changing housing and housing affordability, but food and food affordability. And if we're going to develop policies that mitigate the harmful effects and enhance the positive effects of gentrification in low-income communities, we're going to have to focus on that more directly and identify policies that protect especially low-income communities. Second, I think we need to move away from evaluating each intervention separately and begin to think about cumulative and synergistic impact. And how do we measure that? Because that's really the question. How do all the things that the CDCs did make a difference? And finally, we need to use technology, use social media, digital technology, big data to make evaluation easier. And I think in the healthcare system, agencies are figuring out how to do that. We need to bring that technology and that innovation to the community level so that we can all get smarter and fairer. Thank you.
Okay, so I think we have some time for questions.
So I'm just trying to figure out, how do you get, community buy-in, especially for, the community chefs? Are they, hired from the community? They live and work in the community?
Yeah, I can answer that. So yeah, the community chefs are, actually failed to mention this earlier, they're mostly based in Bed-Stuy. They're low and moderate income people themselves. They're mostly, I think out of our 23 3 chefs, like 22 of them are black, which is representative of Bed-Stuy, historical Bed-Stuy. And that's part of it. That's a big part of it for us is representation, that the people who are learning from people that they see as peers, people that they see as of their community. Also, early on in the needs assessment process, a lot of what we were doing was piloting and focus groups. We were learning from the community what they wanted us to start doing. So a lot of our programs are very much in response and constantly changing in response to what we're seeing the community is calling for. And so I think the buy-in sort of starts there.
So my last
We
question.
do a ton of outreach too.
So when you have your community chefs, do they go out to the community, to an organization, or do you invite the community in?
Both. So we, NEBCO runs a food pantry, and we do distribution weekly, and actually on Tuesdays and Thursdays. And every Tuesday we have a cooking demonstration by our chefs for our pantry clients. And since we see about 19,000 clients a year, we're reaching a lot of people there. But we also go all over the community. So we go to early child care centers very regularly. We go to farmers markets. We go to the City Harvest Mobile Market. We go kind of anywhere people will have us. And this is sort of what I was speaking to earlier was by our community chefs being able to be on their own, they'll be even able to go further. And we pay them really well for the work. But right now it's side gig money, you know. I think through us, they're making about $2,200 a year. And then through connections with us, they're making about another $2,100 a year, which is great. That's a decent amount of money. But we'd like to see this become a part-time or a full-time job for many of them.
Thank you.
Another question? You've got a microphone coming around.
So I think it's a question to kind of combine the evaluation with the folks on the ground, which is one of the things you said is it was really hard to make change with the existing food providers, and so there's sort of not an alternative, but maybe a supplemental community system. So my question is, what are you guys on the ground who are part of the supplemental, is that a viable option that really going to create not a parallel but maybe a supplemental, and is that really, is it resilient, is it resistant, can you survive economically, is this a grant driven thing? I mean, what's the systems change there? So when you listen to what he said, how do you interpret it, I guess is the question I'd be interested in. One of you.
All right, I'll try to take this on. Yeah, this is something we definitely spend a lot of time thinking about. I think how I've started to think about our program is that we're like modeling community responsive kind of interventions and strategies. And I think really what we need to move in the direction of is like how policies and systems change can actually not be super top down, but responsive to what each neighborhood needs. And I think the kind of like what we're all grappling with is that what's happening now is like not providing for our communities in terms of what they need. So when we do have this super top-down capitalist food system, it's not serving the needs in terms of accessibility or what people are looking for or affordability or any of these things. So as much as we can try to create like a new paradigm that's at least trying to show the way, I think that's super important. So yeah, like, I mean, our farm stand individually is not going to, totally transform the eating habits of the community. For one thing, it's only July through November, and people have to eat all year round. But I do think as much as we can kind of pave the way for those types of options, it starts to change and then influence some of the other options. And, it's also about like, where are we putting our money and time and resources? And I just think that the more responsive things are to folks on the ground and led by community members, that's so much more impactful, and also has so many other benefits in terms of like employment opportunities and supporting upstate farmers that also kind of reverb in a very different way.
Thanks. I think if we think about leveraging both the public sector in food, which is institutional food, SNAP, and this community constructed alternative. And actually, many of the CDCs are involved in institutional food programs in child care centers and senior citizen centers, and in some cases, schools and after-school programs. That the civil society sector and the public sector together are really a significant part. Each year, the city spends hundreds of millions of dollars on institutional food, and it's gotten a lot better in the last few years. Billions of dollars right here in New York City from SNAP expenditures. And what we need to be thinking about, and I think organizations like CDCs are, how do we pressure, encourage, promote putting those sectors together to do two things. One is create an alternative for people who want healthy, affordable food and aren't finding it in the market-dominated system. And two, be a competitor that actually gives better deals and therefore changes the practices of the dominant sector. And I think a small example from Green Carts, when Green Carts opened on many city streets, the local bodegas and supermarkets started to offer fruits and vegetables because they didn't want to lose that business. And that's a really positive effect of Green Carts. And similarly with farmers markets, the Grow NYC and other community-based farmers markets opening, they change practices in the supermarkets, both on quality and in some cases on affordability. So we need to leverage that, and I think the CDC's really made important steps forward in figuring out how to do that.
Hi, I'm Maxine Golub. I'm with the Institute for Family Health, and we run the Bronx Health Reach Project, and we work with several other partners, including Montefiore, to run a Bronx Bodega network. And I just want to piggyback on this discussion because I think it's really important not to leave the established food purveyors out of the picture and to assume they won't change. One of the things that we've worked on is providing training to bodega owners through the Bodega Association. And that the bodegas obviously are key in their neighborhoods. They serve a function beyond just providing food. And through training, we've helped them figure out how to make selling healthier food more profitable. And that has made a difference. And even some of the local grocers like Fine Fare have also participated in some of the changes, as well as some of the local restaurants. I think it would be fabulous if you could evaluate some of that change because, they're there and they're there 12 months a year. And I think we would be making a mistake as a movement if we don't include them in our continued efforts to improve the quality of food in the neighborhood.
I'll just respond quickly. I agree, and I think actually probably all four of our organizations, we just didn't talk about it today, have done work with bodegas and supermarkets, especially tapping into the many partners in New York City who are doing that work and collaborating with them. I think one thing that we found was that for New Settlement Apartments, our expertise and our ability to contribute was not best primed for that kind of work, in part because there are so many groups that are doing it who have a more, who are more like borough-based or city-based and can kind of build a wider network. And so, City Harvest, the Department of Health, Bronx Health Reach, you're all already doing this, so we kind of felt like that's good. And we partnered with you, when it makes sense when you're in our neighborhoods. But so I think it's great if, collaboration in New York City sometimes means like stepping away when there are other folks who are taking the lead on things so that we don't all have to be like in the same thing on every single project.
Yeah, and just real quick, we were doing bodega work in the beginning, and what that means for us now is that we just do cooking demos at bodegas. But we've sort of pulled back from any kind of trying to change the bodegas work because other people were doing it better.
Another thing that we are doing in my school with the bodega is that we have a healthy snack tags where we go to the bodega and put those tags, the bodega, to help parents in the neighborhood how to get their children to get healthy snack. We have, like, for example, instead of getting Takis, why don't you get a popcorn? So we have a picture of the popcorns in some tags, and that helps parents to be smart and have their kids to choose some from one of those healthy options that we tag in each of the shelves in the bodega.
So I think there's no one solution to the food problems facing low-income communities. And I'm a believer in letting 1,000 flowers bloom, and we ought to be trying every approach and evaluating it. I thought for the last few years there was a direction in overall urban food policy to think that the solutions would come in the market sector by transforming it. And that's what I think it's maybe necessary but not sufficient. And I think so many bodegas are so embedded in a food system where profits come from shelf-stable, high-fat, high-sugar, high-salt food, and that federal policy, global policy, and large food companies, that's how they make money. And to think that at the community level we can make significant transformations is idealistic. So I think we need to do both things, and figuring out how they work together and how we can accelerate the changes. I think that's exactly where we need to be. And from what we saw the CDCs were doing, that's the space they were exploring, and I think that's where we should be focusing.
So I think we have time for one more question.
This is Sam. Hello. I wanted to ask a question that introduces an idea that Dr. Barbeau and I were meant to cover, but we didn't really get a chance to. And that is, we started off the conversation about the community development sector and the health sector. And I'd be interested to hear about where the health sector is intersecting with this work, and particularly around who's paying for this work now. Is it the health sector? Is it not? Why not? Because that's where we want to begin to bring the conversation.
Cool. I can answer some of that. So currently, I think none of my funding comes from the health sector. However, I am very much going after state DSRIP money right now. And I don't know if that's going to come through. But through those conversations, we've been thinking a lot about our relationship to health. The thing about food is that as I'm sure most people in the room know, you can't talk about food without talking about everything else, very much including health. We have been thinking about our program's relationship to it a lot lately. We're in conversations right now with the hospitals that are going to be merging to become one Brooklyn Hospitals in Brooklyn, Kingsbrook, Interfaith, and Brookdale. I have my friend from Interfaith over there. A lot, we're also in meetings with 1199 and New York State Nurses Association, talking about them joining our food co-op that we're, consumer-owned food co-op that we're trying to start. We're talking about doing cooking demonstrations and offering health coaching to their members. These are thousands of members. So these conversations are sort of in their very early stages, so no promises. But we're very much hoping to forge these relationships to start doing more in these hospitals for both client populations and the staff at these organizations as well.
Thank you guys so much. This is really interesting, helpful discussion. So we are going to take a 10-minute break. Are we still more or less on time? Yeah. I think we could still do a 10-minute break, if that sounds okay to everybody. We'll come back here at 11:07 and get started with our next panel. Thanks, everyone.